First, I'd like to introduce and invite Chief Peter Bartlett, from Manchester, undercover narcotics officer, now a Hooksett chief of police, 28 years of law enforcement experience, and so grateful he can be here today on our roundtable. We have Becky Vaughn, Vice President of Addiction for the National Council of Behavioral Health. Becky's an accomplished advocate, also my go-to treatment expert, and she has an extensive background in addiction services as well as implementation of parity. Prior to coming to the National Council, Becky was CEO of the State Associations of Addiction Services and President and CEO of the Georgia Council on Substance Abuse. I'd also like to invite Doug Griffin. Doug is a U.S. Coast Guard veteran, current member of the Board of Directors for the Merrimack Valley Prevention and Substance Abuse Project. He's Vice President of Project Recovery as well, which is a newly formed nonprofit organization in New Hampshire whose goal is to open the Courtney Griffin Sober House for Women. Doug is a well-informed advocate for those suffering with addiction, as well as addiction's detox, treatment, and recovery process. It is his goal to ensure that any person that wishes to walk the path of recovery will be treated fairly and respectfully. Thank you for being here with us, Doug. We're so grateful to have you at our second forum in New Hampshire. I'd also like to invite Paul Porter, who you heard from earlier, his amazing account and testimony about his path to recovery. And Benjamin Burks is a Bible college graduate and has previously worked as an assistant pastor and senior pastor and staff evangelist. He has been in ministry since 1984. He is currently the International Director of RU Recovery Ministries, a faith-based local church discipleship program for individuals struggling with crippling habits and addictions. I'd also like to invite Holly Cekala. Holly is the, thank you, come on up, is the Director of Recovery Support Services for Hope for New Hampshire. She has recently opened the first recovery community center in New Hampshire, which is fantastic. A person in long-term recovery herself, she passionately advocates for those in recovery and their families and has organized many public forums and rallies to educate the public regarding recovery and addiction. Holly previously served as director of Rhode Island Communities for Addiction Recovery Efforts and manager of the Anchor Recovery Community Centers in Rhode Island. Well, welcome, Holly. Also our second forum in New Hampshire. She was here in January with us. I'd like to welcome Marcia Lee Taylor. She's the president and CEO of the Partnership for Drug-Free Kids, a nonprofit organization dedicated to reducing teen substance abuse and helping families impacted by addiction. In addition to her leadership there, she also leads the Medicine Abuse Project, a communications and education campaign aimed at reducing teen prescription drug and over-the-counter cough medicine abuse by 500,000. Previously, she served as senior advisor for drug policy and research for the Senate Judiciary Subcommittee on Crime and Drugs, and the Democratic Staff Director of the Senate Caucus on International Narcotics Control, working for then Senator Joe Biden. I'd also like to welcome Senator Cruz to join us for our panel, which we're so excited about. And we're going to have brief remarks from all of our stakeholders and our panelists, followed by a little bit of Q&A. Thank you so much for taking the time for us. Am I too close to that? Okay, Chief, did you want to start us off and give us a little bit of sense of what you're seeing here in Hooksett in New Hampshire?
Sure. My name is Pete Bartlett. I'm the Chief of Police here in Hooksett, and I want to thank you for inviting me to this today. It's a very important topic, as we all know. We've been hearing a lot about it, and I'd like to give a little bit of perspective of the local law enforcement, because although Hooksett is a small community here in New Hampshire, we're not immune from this plague. And what we're seeing on the front lines, even in a small community such as Hooksett, is families that are being destroyed by heroin overdose and addiction. In 2015, Hooksett Fire Rescue used Narcan 31 times. And we've responded to drug overdose deaths in the last 2 years just under 10, and those are astounding numbers for a small community in New Hampshire. As Paul had indicated during his remarks, I worked undercover narcotics when I was a young officer working for the city of Manchester back in the late 80s and early 90s when crack cocaine was first coming on the scene and it was flooding into the state. And a lot of things that I saw back then, I'm seeing today repeat themselves over and over again. And one of the things that I didn't see back then was I never saw law enforcement partner with recovery and treatment as such that we're trying to do today. And that's one of the things that we know as law enforcement is we can't arrest our way out of this. We can't keep putting people in jail without helping them and giving them some sort of avenue to get better. And we all understand that. And that's sort of what we're seeing on the front line today. And it's important for us in law enforcement to know that we've got the partners in the community so we can do our job and that we can help these people get better so it doesn't keep repeating itself over and over again. The last thing I want to do, and I've done it so many times, is knock on someone's door in the middle of the night and tell them that their loved one is dead from an overdose. It's a terrible feeling, and this side of, in my side of law enforcement, it's a terrible feeling to see that grief happen live in front of you. And it's terrible to know that those people are leaving behind children and families and friends that care deeply about them, and they couldn't stop it. So I think that some of the things law enforcement is looking for is to be able to continue to do our jobs. One of the things that I would like to see, and that we're working very hard with in partnering with our federal partners, with the DEA, the FBI HIDTA Task Force, the State Attorney General's Drug Task Force, is anybody who's peddling this poison to our communities, I would really like to see penalties that are appropriate for that, when we have drug dealers. And the money that's utilized or that these drug dealers make for profit there's efforts now to take that away from us because we can use that in the drug forfeiture fund to fight that battle with these funds. And I'd like to see that continue. I'm fearful that I'm not going to have those funds available, or bigger communities aren't going to have those funds available. So that's some of the things that we're seeing on the local level in law enforcement, and hopefully that we can, as this moves on, we can all partner together and make this a success. Thank you.
Thank you so much. As Pastor Davis mentioned earlier, and I wholeheartedly agree, the face of this, the sort of not losing sight that this is our loved ones, our moms and our sisters and our families that we are sort of talking about at the end of the day. So we are so delighted to have Doug with us, who has, from a family member's perspective, really sort of shared the impact on his own family. So Doug, can you give us a few words?
Sure. I'd like to put a pretty face on this problem if I could. It's my daughter. We lost her in late 2014. And all of last year I spent going around touring, telling people what it was like, what the signs of addiction were, the things that she had done to our family, the devastation. But this year, I'm speaking about recovery and about the things that are being done to change this, to erasing the stigma and making changes. I'm a member of the Kingston Lions Club, as was Courtney. She was a charter member of the club. And we're having our first ever golf tournament this year, and we're donating the proceeds of that golf tournament for substance abuse recovery services and education. And that's a giant step for somebody like the Lions. There's 1.3 million Lions in the world. And I'd like to challenge all the Lions to pitch in and to contribute to this cause, because although we're known for sight and hearing, this is a vital thing that's happening in our country. We need to really help save these kids. We're losing a whole generation. 129 people a day are dying from overdose. Also, in our church, we have Pastor Aaron Goodrow, who has a service for our church the third Sunday of every month for addicts and their families. And now we're averaging about 60 people a month that come in, and there is no stigma in our church. And we have active users, we have people in recovery, we have folks that have lost their families. It's a real grassroots effort, and other churches are coming and seeing what it's about, and I think it's spreading pretty well. It's a great service. We have Project Recovery, which is planning to open up the Women's Sober House. So we're very active. We have people like Holly and Eric Spofford, who's doing great things for our state. Because the government can't provide enough money to get us out of this jam. We need corporate America to step up. We need the people to step up. We need the grassroots efforts to continue. And after next Tuesday, when all the big guys go away, nothing personal, we still need to keep this fight up. We really do. Thank you very much.
And we have also Holly from Hope for New Hampshire, so if you could give us an update on sort of where we stand and the barriers you see and things that we should be advancing.
First of all, I'm thankful that we have a faith-based community that is taking steps to try to understand better that this is really just a human issue and that God loves everybody, right? So everybody is worthy of forgiveness and second chances. I don't know. That's the way my God taught me. But, okay. So I'm glad about that. And I think that you happen to say something that hits my brain that I got to ask you about. You said the government's not going to do this. And, from my perspective, sitting where I am in New Hampshire today, we haven't seen government funds from our center. We haven't seen state funds yet from our center perspective. We are really a collaboration of diversity to try and harness this. We have family members who have survived a loved one. We have people in recovery. We have people seeking recovery. We have the faith-based community. We have all of these people. The Chief Willard in the town is really, it's about building healthy community. We understand that. But in that presence, we still need medical intervention, right? We still need to get people medical intervention. And we didn't see a way. So we did kind of try and get entrepreneurial and ask businesses to step up to the plate so that we could still provide these services, bar the government stepping up to do these things. And there's been some great businesses to show up to the fight and say, yeah, we want to offer recovery services to our employees as well. Because as we know, most of the people that meet the criteria for substance use disorder are working, right? And they're in their families and they're doing their things and they don't reach out for help. The faith-based community is largely there for the people that will walk through that door, but there's other doors to walk through. So how are you going to get government to support those health initiatives in conjunction with the community efforts and the peer movement?
Well, look, there's no doubt that there is a role for government and an important role for government. And so, I'm supporting legislation right now in the Senate that would direct funds to drug treatment and rehabilitation. I think that's important to do. The point I was making is that it's not going to be the government that solves this, that it is going to take people on the ground connecting directly one person at a time, churches and charities, and people have to make personal transformations.
Agreed.
But I very much agree that we have to have resources directed on the medical side as well. Absolutely.
Well, I'm glad to hear you say that.
Yeah.
Thank you.
You use the words medical intervention. What's missing today that was always there in AA was when somebody was in an asylum, the doctor would call up the people he knew were in AA and bring them in when that person was in the right state of mind to hear someone else's story and connect with them. Same thing with hospitals. And I know there's some legislation in front of the New Hampshire Assembly, right, the state legislature right now. And one of the things that concerns me is that legislation's all going to be written so only, quote, professionals, what they call counselors, or which they're going to be, people that have titles and getting paid by agencies, and that the regular people that have done this for 80 years are going to get excluded out of that. And that's extremely concerning to me because I know that I went to the First Baptist Church at Jacksonville and I was asked to give my testimony there, and a woman came up to me and said, "My son's in jail, will you go talk to him?" Well, when he got out of jail, I saw his mother lately, which was 3 years later, says he's never used it again because I knew from reading the big book, I knew how to talk to that person. I knew how.
I'll agree with you, Paul, that we definitely need to use peers in everything we do because they have the expertise and the survival skills, quite frankly. But per the traditions of the big book, we want to be respectful of that. And we also need to get people with this experience back to work without violating the traditions that Dr. Bob put forth, right? So recovery coaches are a way to do that. We are now working to get into hospitals, to bring people with lived experience into hospitals, give them work, to give that hope. And it's a great program. I would invite you to come down and take a look. So I do agree. Peers are part of the solution.
Absolutely. Thank you, Holly. Becky Vaughn with the National Council for Behavioral Health.
Thanks. Senator Cruz, thank you. This often seems to be a really difficult issue, and so I appreciate you wanting to put a focus on it as well as everybody else here. And let me thank those of you who are working in the field and working with people. It sometimes is a very thankless job, and I know many of you are here. I've worked with many of the providers here in New Hampshire, and you guys do a great job in a very tough environment. But in many ways, this has got very simple solutions. We have come so far in terms of research and knowledge, just like other chronic diseases, and we know so much more than Bill W. and Dr. Bob knew when they got things started for people way back. And that is what the good news is. We now know that this is a brain disease, that it can be prevented, that there are appropriate treatments that can be used to help people, and that then when people are in a situation to manage that disease, we can support them so that they can sustain that recovery. And that, to me, is what is so important. Like other chronic diseases, we have the brain science. Like cancer, we now have assessment tools so we can figure out exactly what is going on, what level of care, what treatment modality will be the best. Like hypertension, we now have great medications to help people who need that sort of help in terms of their own disease, like Vivitrol. We mentioned naloxone to help reverse. There's some great things to help people. We know, even like diabetes, that some people do get well on their own. They do learn to manage this on their own. But for those who don't, we have evidence-based treatment modalities that can help that person get to a point where they can manage this chronic disease. And to me, that's the good news of what has come out of the research in the last 20 years. The fact that we know so much more in terms of being able to help people. We're not putting them into asylums because we don't understand what's going on. We're actually giving hope. But at the same time, when we seem to be able to mobilize and respond to other serious medical crises, look at the Ebola reaction. And everybody remembers how many people died from Ebola? Not very many compared to what's going on with this. So we do know that government has the capacity to mobilize all the stakeholders. You're absolutely right, not just government, but everybody, to address something that is truly an incredible crisis. So if we decide that this is the medical issue that it is, why would Jessica and I continue to be frustrated that it's not being addressed? And so to me, that is the big issue. We know what to do. We have the tools what to do. So the issue is, are we going to do it? And we look to our leaders to make sure that that's going to happen. And to me, that's where we are and what we need to be focused on. Making use of great research, making use of all that we know so that we can help the people, the families, and the communities that need our help.
Thank you, Becky. And speaking of preventing this disease in the first place, Marcia Lee Taylor from the Partnership for Drug-Free Kids.
Thanks, Jessica, for organizing this and bringing us all here today, and thank you, Senator Cruz, for being here. For those of you who aren't familiar with the Partnership for Drug-Free Kids, we're a national organization that aims to reduce adolescent substance abuse by supporting parents and engaging with teens. And we know that addiction is a family disease. it's not only the person who's struggling, it's really the entire family who is affected by this. But unlike other diseases, there aren't really the support structures in place for families as they're trying to help their child recover, as they're trying to help their child get into the treatment that we know works, as Becky was saying. We also know that 90% of addiction starts in the teenage years. So we need to do a better job of preventing this disease as we're supporting parents who are grappling with this in their own families. And prevention is one of those issues that it's sort of like eating your vegetables. People kind of, dismiss it and say they'll get to it another point. But it's really critical, and it's the heart of everything. And over the past decade, federal funding for our prevention programs nationally have been cut nearly in half, including the programs that meet kids where they spend most of their times, in school and consuming media. So those of us in the prevention field are kind of fighting this with one arm tied behind our back because we don't have the resources we need to make sure that we're getting to teens, that we're reaching them to let them know that, that this behavior is dangerous, that it's not a rite of passage, that it is a big deal. At the same time, at the partnership, we're trying to help parents find help for their kids. And we provide them with resources online that translate the best science into really tangible, actionable tips and tools. But one of the big frustrations that parents have, and a lot of the parents that we deal with have lost a child or who have a child who's struggling and really are having a hard time getting help for them, one of the issues that they're really angry about is the medical system has failed them, and it doesn't take their problems seriously. And insurance companies aren't covering this treatment the way they're legally obligated to do. And it's a giant problem, and it needs to be addressed. So unless we're preventing it, giving families the tools they need to help their kids and intervene, and making sure that there's coverage and that there's an adequate response from the medical community, we're not really treating this like the disease that it is. And if you compare it to another public health problem like heart disease, we realize with heart disease it's not just about, triple bypass surgery and sort of helping someone when they're in the worst possible moment of crisis. It's really about exercise, healthy eating, making sure every time you go to the doctor, they're screening by, listening to your heartbeat and checking your blood pressure and making sure they're on top of it. So I think we really need to do a better job of really approaching this from in a comprehensive way if we're going to make a difference and stem the tide.
Thank you, Marcia. We've talked about the importance of making sure we have all the key players. We have Becky Recovery, we talked about peer supports, we talked about recovery support, and also the importance of having our faith-based treatment providers be a part of this discussion at the table. So we're so glad that Ben could join us today from RU Recovery.
Thank you so much for inviting us here. Thank you, Senator Cruz, for being here as well. Thank you very much. RU Recovery Ministry was started 20 years ago this coming April in a very difficult place called Rockford, Illinois, northwest of Chicago. And it started by a man who grew up in a good church, went to the Christian school, graduated, and boy, I tell you, after he graduated, met some bad friends, began to do some bad things. And I guarantee you that story can be repeated in this area. And he said the drinking got harder, the drugging got harder, the smoking got harder, the doping got harder. Cost him a decade of his life, 10 years in the world. He tried the secular programs, but they didn't work for him. And he had a car accident, nearly took his life, and the lady that lived in that neighborhood, the ditch he landed in, was the only person who lived in that area, called 911 and saved his life. And took him to the hospital, and they began to work on him. And he had a desire in that hospital, I need to go back to church. Surely somebody can help me. And he told his mom on Sunday morning when he got out 3 weeks later, Mom, I'm going to church with you. Long ponytail, earrings, the whole 9 yards. And he walked into the back of that church, and that church head deacon came up and said, welcome home, Steve. We're glad you're here. By the way, that's what every church ought to do. Every church ought to do that. They put their arms around that young man, and Paul Kingsbury began to disciple him and help him in his life. And he recovered. He's not in recovery, he's recovered. And God absolutely transformed his life. They put that material into a curriculum, much like Bill Wilson did 80 years ago. And this is the new cutting thing on the block. We've got 1,044 churches now across this country that run the RU program. 50,000 people come to the RU program on a weekly basis. And they're finding recovery that lasts. And that recovery is not in a what, it's in a who, and his name is Jesus Christ. And we had to figure out this book right here was not a self-help book. This is a God-help book. And this is what we get to get people back to. We also have a residential home in Rockford, Illinois. I just got this statistic today because this problem of heroin is not just here. We have a men's home, 42 men in our home today. 17 are there because of heroin addiction. We have a women's home, 28 ladies in our ladies' home today. And we have 8 that are there because of heroin. 17 men because of heroin, 8 ladies because of heroin. We have local chapters filled with people, and I could give you testimonies from now till 2 or 3 days from now of people that have absolutely found freedom through Jesus Christ. There's RU workers here and pastors here that can tell you this thing works. It works. And here's what I like about this area. Here's what I like what I've heard so far today. It's going to take some meekness for us to get this problem solved. Paul said it this way, and the servant of the Lord must not strive, but be gentle unto all men, apt to teach, patient, in meekness, instructing those that oppose themselves. That's who we're trying to help, the people who are opposing themselves. Then it says this, if God peradventure, you see, we've got to bring God into the picture. We're made a trichotomy, a 3-part being, body, soul, and spirit. But it's never that way in the scripture. It's always spirit, soul, then body. We put so much emphasis on the physical. We put so much emphasis on the psyche. But the answers, everything else lines up when you approach it from a spiritual standpoint. It's amazing. And that's what we're finding in the RU class and the RU program. And we're just excited to be here. And the meekness that we experience. And here's what the verse says. Listen carefully. If God peradventure will give them repentance to the acknowledging of the truth. They've got to be faced with truth. They've got to acknowledge the truth. And boy, when that happens, there's a transformation that begins. Amen. And then that they may recover themselves. You see, they got to have a part in this too. The addict's got to want it. Faith-based isn't for everybody because some of them just don't want it. But the ones who do, thank God we can work with sheriffs like this one and people across this country that says, hey, we'll court order people to you. If they quit, then we'll put them in jail. We got people right now in our homes that they have to be there. RUhomes.org. They have to be there because they're court ordered there. And there's communities across America that's facing the same thing you guys are facing. And you can't leave the faith-based alternative out. Pull them in. Work with them. And you will see the same kind of incredible success that we're seeing. I'm talking like 86% success rate. We ought to say 100 because Jesus always works. Amen.
Thank you. Thank you, Ben. Now, we have a couple questions for our roundtable just to start a discussion, so please, some are directed and please chime in. So first, families are very frustrated with how difficult it has been to navigate the system and get help for their child. What would you say to these families, and what steps would you take to ensure there is more support for families who are struggling to find help for their child before it is too late? I'll to pass the mic around. Becky?
No, you're absolutely right. And part of the problem is because this has not been treated like the medical issue that it is. I think as we move forward with more and more people having insurance and our new parity regulations that require this to be treated along with mental illness in the same way, we will begin to see better resources. I always tell the story of the mother who saw signs of diabetes in her son. She was a good mother. She had tried to protect him and prevent this, and he He had made some bad choices in terms of lack of exercise and diet, but she recognized it. She knew what to do. She could talk to the doctor about it. There were support groups. There was all kinds of help for her to intervene and take care of her son. Unfortunately, on the other side, the way things have been, another mother, just as good a mother, who tried to think about prevention of drugs, but like has been said here, a lot of times parents don't have the tools to know how to talk to their kids about it, how to talk about prevention beyond just say no. And so what happens is, again, this son made some bad choices, ended up with this disease. The mother is beginning to see, but doesn't have a support group, doesn't know who to talk to, is embarrassed because many people blame the parents when this happens, and so the child does not get the help they need because of the situation. As we move forward, and this is part of everybody's insurance card, whether it's Medicaid, whether it's other types of insurance, no matter what it is, and people begin to realize, oh, this card is good for hypertension, this card is good for cancer, and oh, this card is good for addiction, and this card is good for mental illness. I think we will begin to see how the system works better, people can get the help they need, but it will take everybody having the attitude that this is the disease that it is, so that people can get the help, so that we reduce the stigma that is the biggest barrier currently to people getting treatment. And so my goal is that every child is touched by prevention and that treatment is available on demand, appropriate treatment. The good news about treatment is there's not just one way. There's no wrong door. Many people do get well in some fabulous faith-based organizations, but other people need other types of treatment. And so other people get well from acupuncture. We need to make sure that all modalities are available on demand when they need it, just like it's the case for every other chronic disease.
If I could add one thing to that. Just shortly before my daughter passed away, our insurance company actually used the phrase that it wasn't a matter of life and death, so she wasn't covered. We have no way to hold them accountable for that, but we didn't know what to do. And I'm sure that there's a lot of families in New Hampshire that are in the same boat that we were, not knowing what to do and just running up against a brick wall. And I don't know if insurance companies have the first person there to just try to rebuff you, to get you to go away. You know, I don't know what the proper approach is. And when you Google, there's nowhere that tells you, you know, how do you deal with your insurance company when you have a child who's begging for help.
What we're seeing in AA.
Here you go.
What we're seeing in AA is we're seeing 23 and 24-year-olds that have this insurance now until they're 26 that are gone through 11 treatment programs. And it's almost like they do it to get a rest. So they go rest in a treatment program that gets paid for because they're now on their parents' insurance till they're 26. Now, AA is not we're not user-friendly in a sense. But by that I mean, we believe people have to be left to hit bottom. You have to leave your kids to hit bottom. You cannot continue to have your child come home. You cannot continue to support your child. Your child will find, and they can't keep going back through these revolving doors of these treatment programs. That's not helping. And we're seeing that, you know, and I go to a lot of meetings, and I have a gentleman that I'm very close to that was my sponsor for a while. I mean, he's been in AA sober for 35 years. He handles treatment in the greater Jacksonville area. He's the executive director of Gateway, which is all of our detox, a number of treatment centers. And he was going to come up here for this but couldn't, and just told me to address this issue, that you got to let these kids, you got to let them hit bottom. You can't, and you know, you just can't keep having them. They've got to find a way to get there.
So at the partnership, you know, we realize that you know, when you Google this problem, you don't get any good answers. So we've developed a lot of tools for parents on our website. to help them with the difficult conversations when you find pills in your kid's room, when your child gets arrested, when you're struggling to get your child into treatment. But one of the other things we realized is that people need to talk to another human being about this. And too often, because of the stigma, they're not doing that as much as they would with another disease that would affect their child. And one of the great things about this presidential election is that people are speaking about the very personal toll that addiction has taken on their lives, and thank you for the courage to do that, and you and your fellow candidates have really done amazing work to chip away at this stigma. But one of the things that we've done at the partnership is created a toll-free helpline for parents at 855 drug-free, where people can talk to a licensed social worker to get concrete ideas about where they can turn in their community, right questions to ask. Is this treatment program going to be a good fit? Do they work with adolescents, et cetera? But we also have a series of parent coaches who've been there, who've walked through this, and with all due respect, we have a slightly different take on the hitting bottom. We try to help parents love their child through the problem, because I'm a mom, and when my daughters have a problem, I want to hold them in, and I want to bring them close. I don't want to push them away and have them figure this out on their own. And when a child is struggling with addiction, oftentimes that's a parent's first instinct as well. So we help them with the tools to be able to do that effectively in a scientifically proven, effective way, so that we're helping them come up with different tools and different ways to cope with this.
I promised the senator I'd get him out of here. He's been here. He's got more engagements to get to. So if you could excuse him, I'd really appreciate it. We've kept him longer than expected.